Okay, everyone, welcome to your class today. I'm sorry that I could not be with you. So this audio PowerPoint should be done in lieu of our class for December 5th, 2012. We will learn how to code for obstetrics and gynecology. We will also learn how to code for pediatrics and congenital anomalies in the ICD-9 manual. In order for you to participate effectively in this lecture, you probably would like to get out your textbook entitled The Complete Diagnosis Textbook. Also, you will need your 2012 ICD-9 manual, and you should turn your ICD-9 manual to Chapter 11, Complications of Pregnancy and Childbirth. In my ICD-9 manual, Chapter 11 starts on page 24. One of the first guidelines that you will see under Chapter 11 is when these codes should be used, when Chapter 11 codes should be used. The range for our Chapter 11 codes is 630 through 679. And these codes do have sequencing priority over other codes. You can use other codes from other chapters in conjunction with this code, but normally your Chapter 11 codes would be primary. You want to keep in mind that according to the guidelines, Chapter 11 codes are to be used only on the maternal record. We can never use these codes on the newborn's record. So again, codes 630 through 679 are only used for the mother. There are other categories that require fifth digits. These fifth digits will indicate whether the encounter is antepartum or postpartum. Antepartum means that this happened prior to delivery, while postpartum indicates that the delivery has occurred. Your categories that require fifth digits would be 640 through 649 and 651 through 676. Another very important guideline is the fact that routine outpatient prenatal visits, remember the key word was routine, that means that there are no complications, can be coded with V22.0, and that would be for the supervision of the first normal pregnancy, and V22.1 would be for the supervision of an other normal pregnancy. So you can code basically your own delivery. Your first child, if it was a normal delivery, would be V22.0 if it's a normal pregnancy. And your second child, if that pregnancy was normal, would be V22.1. So V22.1 could be used for the second child and any additional children. Notice that V22.0 and V22.1 cannot be used with your Chapter 11 codes. Again, V22.0 and V22.1 cannot be used with Chapter 11 codes. Chapter 11 codes indicate that there is a complication in the pregnancy, while V22.0 and V22.1 indicate that these pregnancies are without complication, so they cannot be used together. You can read more about this on page 217 in your textbook. Now, if the patient is high risk, there is a code for that. The guideline states for routine prenatal outpatient visits for patients with high risk pregnancy, their code should come from category V23. So notice that this is a routine visit, but she's just high risk. So her code would be V23. Again, the guidelines change. Because she's high risk, you can use your Chapter 11 codes with the V23 code. And again, you can refer to page 217 in your textbook for more information. So just to review to make sure we get the point, V22.0 and V22.1 cannot be used with Chapter 11 codes because Chapter 11 codes indicate there is a complication. However, if the patient is having a high-risk pregnancy, we should code her with V23, and we may use codes from Chapter 11 to indicate what the complications are. Another guideline that is extremely important is outcome of delivery. You would use V27.0 through V27.9. And again, this should only be in the mother's record. You cannot use these codes on the baby's record. And you can read more about this on page 222 to 223 in your textbook. We cannot use these V27 codes on the baby's record, but we'll find out later which codes we should use for the baby. So if the mother has HIV, how should this be coded in pregnancy? Well, during pregnancy, if the patient is admitted because of an HIV-related illness, her principal diagnosis would be 647.6 along with the appropriate 5th digit followed by 042. So again, if she's admitted because of an HIV-related illness. Now, if the patient is asymptomatic, meaning that she's HIV positive and there have been no symptoms, then we would code 647.6 with the appropriate 5th digit and V08. So basically, your principal diagnosis code is the same, but depending upon whether she has HIV or is simply a carrier, the second code would change. What if the patient is diabetic and she's pregnant? So if the patient is already diabetic, but then she gets pregnant, the pregnancy should be coded with 648.0, and you will need a 5th digit. This code indicates that diabetes is complicating the pregnancy, and then you would need to have a secondary code from category 250 or 249, whichever meets the requirements in the scenario. Now remember, if the patient is taking insulin for long-term use, we can use the third code, V58.67. Gestational diabetes is different because it occurs during the pregnancy. The woman did not have diabetes prior to getting pregnant. So if the patient has gestational diabetes, notice the highlighted section there. It says gestational diabetes is coded to 648.8 along with the 5th digit, which is abnormal glucose tolerance. Code 648.0 and 648.8 should never be used together on the same record. So let's just back up here. Remember, 648 states the patient was diabetic prior to pregnancy, and I'm sorry, that was 648.8. She's 648. Excuse me. Let's go back. 648.0 indicates she was diabetic prior to pregnancy, while 648.8 indicates that this was an abnormal glucose tolerance during her pregnancy. So again, we cannot code these together. But if the patient is on insulin, you can use the V58.67. If the delivery is normal, then you will need to use a code 650. And of course, it is always the principal diagnosis. Now please note the area in green. It is not to be used if any other code from Chapter 11 is needed to describe a current complication of the antenatal delivery or perinatal period. So again, 650 can only be used if the if the delivery was normal. Again, we have the outcome of delivery, which is only coded in the mother's chart, and that outcome, if it's a single live born, would be V27.0. And this is the only outcome of a delivery code that should be used with 650. So now we need to discuss the postpartum period. The postpartum period is after the delivery, and it begins immediately after delivery, and it continues for 6 weeks. The peripartum period is defined as the last month of pregnancy to 5 months postpartum. And this is important because sometimes a test question can say postpartum or it may say peripartum, and we want you to be able to know the difference. So if the patient comes to the office for her postpartum care, her diagnosis code, if everything is okay and there are no complications, her diagnosis code would be V24.0. Another important item that you will have to code will be abortions. The abortion coding information can be found in your textbook on page 228. And hearing that term abortion, you should not start to think of, getting political or becoming religious, because some people in medical terms have abortions because of issues that are out of their control. And these abortions can be spontaneous or they can be induced. So if you were coding a spontaneous abortion, it would come from category 634. 634. And a spontaneous abortion is, in common language, is called a miscarriage. Now, your book also lists other categories for abortions on page 228, and you can turn there to read a little more about those. But keep in mind that the 5th digits are required to indicate whether an abortion was complete or incomplete. Your assignment for this chapter, of course, is to read the chapter. You will also need to complete pages 234, 1 through 10, and also pages 235 through 236, 1 through 15. After you complete these pages, please check your answers with the answer key provided, and then upload your corrected work in Moodle. You may be tempted to simply copy the answer key. That will not be to your advantage, because most of your final exam is taken from chapters 9 and 10. So you can put this on pause now and do the assignment. Okay, so now we need to learn how to code congenital and pediatric conditions. And again, the PowerPoint is based on the guidelines, which is what the authors use. They usually copy the guidelines and then they give you examples throughout their textbooks. So it's very important for you to know where the guidelines are, so that if you're taking the national exam or you're working in the doctor's office, you can find the information that you need. On this slide, what I think is important is that a congenital anomaly can be the first listed or the principal diagnosis, and sometimes it can be the secondary diagnosis. Also keep in mind that these codes in Chapter 14 can be used throughout the life of the patient. But if this anomaly gets corrected, it should not be coded as if they have it today, but it should be coded as a history, which usually requires a V code. Chapter 15 guidelines describe for us what they mean by perinatal or newborn. Notice the definition provided in the guidelines. For coding and reporting purposes, the perinatal period is defined as before birth through the 28th day following birth. So sometimes you'll see the number 0 through 28 indicating that the patient is basically a neonate. And most of the time, hospitals code for the neonates. These codes for the baby are never ever used in the mother's chart. Codes from Chapter 11 are never permitted on the newborn record. But remember, we can still code anything from Chapter 15 throughout the patient's life if the condition is present. Keep in mind that Chapter 15 should be sequenced as the principal diagnosis on the newborn record, with one exception, and that is with code V30. That is describing how the baby was born. And let's just take a moment to find that V code. You want to go to your ICD-9 manual, and you would need to find the code V30 in the back, in the V code section. When you find the V code, please note that you will need to add 2 digits to the end. V30 is 3 digits, and then your 4th digit should tell us where the baby was born. Was the baby born in the hospital, born before admission, or born outside of the hospital? Your 5th digit should tell us how the baby was delivered, with or without a C-section. So if a baby was born in the hospital vaginally, then the code would be V30.00. You are also encouraged to use V31 through V39 if it applies. These codes are assigned normally as the principal diagnosis. Now, if the baby is transferred to another institution, you cannot code the V30 series at the receiving hospital. So if the scenario states that you are coding for the receiving hospital, then you cannot use V30 because the initial hospital has already coded the baby's birth. So the new hospital would not code the baby's birth again. On this slide, we have congenital anomalies in newborns. The guideline states for the birth admission, the appropriate code should come from V30, live-born infants according to the type of birth, followed by the anomaly. So again, we would still code the birth and then the anomaly. Codes that describe congenital effects can also be found in your textbook on page 247. There is a coding tip there that tells you to review codes 740 through 759. And it tells us in that coding tip that these codes should be used whenever the condition is treated, regardless of the age of the patient, whether it's 9 months, 9 years, or 90 years. There are other guidelines too, and one thing that I'd like for you to know about is mentioned on page 254 of your textbook. And on page 254, it mentions routine well baby checkups. So when children are released from the hospital, they need to have their checkups. So let's go back to the V codes, and we're looking at code V20 this time. We're looking at code V20. And code V20 is a 3-digit code. So let's take a look at V20.2. Now notice that this is a routine infant or child health check, and for a child over 28 days old. But it tells us that if we want to code for a child under 29 days old, we need to look at V20.3. And at V20.3, we see a health check for a child under 29 days old. We even have a code for under 8 days old. And then V20.32 is health supervision for newborn 8 to 28 days old. So this is very important, especially if you are responsible for doing the coding for the alphas. So in this particular section, your assignment is page 257, 1 through 10, pages 258 through 260, 1 through 15. After you complete this assignment, use the answer key to check your answers. Then you should upload the corrected work in Moodle. Once again, I'd like to remind you that this is a large portion of your test. So you will need to make sure that you are able to code these items. If you have any questions, please feel free to email me, and I look forward to seeing you next week. Thank you for your patience. Have a good day. Bye-bye.